Hello and welcome. You're watching Coronavirus Facts versus Myths. I'm Gargi Rawat. Let's take a look first at the data that has been released by the Health Ministry. Now, India reported the lowest single-day rise in COVID cases in 209 days with 18,346 new infections in the last 24 hours. The country had reported 20,799 cases yesterday. At least 263 deaths due to COVID were also recorded in the last 24 hours, and that's an increase, as you can see, by 83 deaths from the previous day. Now, active cases comprise of 0.75% of the total infections. That's the lowest since March 2020. And the active caseload at present is 2,52,902, which is the lowest in 201 days. Now, Kerala, which is showing a decline in daily fresh cases after it had crossed the 30,000 mark post-Onam festival in August, recorded 8,850 cases. So, cases on a decline right now, though experts do say to continue being cautious and wary given that we're going into the festival season now. Union Health Minister Mansukh Mandavia has said that 70% of India's adult population has been administered the first dose of COVID vaccine. A strong nation, rapid vaccination. India has administered the first dose of the COVID vaccine on 70% of the population, is what the health minister tweeted yesterday. He said, "Keep it up, India. Let us fight Corona." Now, so far in the country, 91.54 vaccine doses have been administered, out of which 25.2 crore have received both doses of the vaccine. So 70% of adults in India have received one dose of the vaccine and 25.2 crore have received both doses. But let's now take a look at India's vaccine equation. That means the target that India has compared to what the reality is. Now, remember, the government has said they want to vaccinate 60% of the population by December 2021. That's with both doses of the vaccine. But at the current rate of vaccinations, only 38% of the population is likely to be fully vaccinated by December 2021. So we really need to up the vaccination rates. Remember, while we have crossed 1 crore vaccinations a day, at least 5 times, we need to be doing that consistently. It has to be at least 1.33 crore vaccines every day if we're to vaccinate 70% of the 60% of the population by the year end. The average vaccination in the last 7 days has been 6.5 million per day. That's 65 lakh. And the daily shortfall has been 6.8 million on October 4th. 2.3 million doses were administered, and there was a shortfall of 11 million doses. Essentially, the required vaccination rate, as we said, is 13.3 million doses a day. That means it should be over 1 crore every single day. Well, let's now take a look at the global situation as far as COVID goes. And the weekly number of coronavirus deaths worldwide has fallen to levels unseen for almost a year. This according to an AFP count, which is based on official national figures. The 53,245 deaths recorded worldwide between September 27th and October 3rd, an average of 7,606 each day, showed that the global pandemic continues the downward trend that began at the end of August after a peak of around 10,000 deaths per day globally. The new weekly deaths figure is the lowest recorded since October 31st, November 6, 2020. Over the last month, the number of COVID-related deaths has fallen by almost a quarter as vaccination campaigns make progress. So there you can actually see the result of successful vaccinations, though, of course, there are many countries that remain to be covered by the vaccine drive. Well, to talk more about all these various news points, we're now joined by Dr. Rajneesh Kapoor, Vice Chairman, Interventional Cardiology, Medanta Hospital. Thank you so much, Dr. Kapoor, for joining us. And first and foremost, your reaction to the news that at least 70% of adults in India have received at least one dose of the vaccine. How effective will that be in fighting the COVID spread?
No, I think it's remarkable the way India vaccination program has progressed over the last few months. So it's not easy for a country, a heterogeneous country like India with such a high density to cover the vaccination so fast and so quick. So initially the pace had been slow, but last few months have been really good. And if we talk that 70% of adult population is inoculated by a single jab, I think it's worth, because that means the 70% of adult population is having some kind of immunity although that would last for few months and they would require a booster dose. That is imperative. We have to have a second dose to have a good immunity, but at least they are kind of partially immunized from the COVID infections for a few months. And now, especially with Diwali around, the festival season around, this was highly required, that some kind of immunity we are providing to 70%, and maybe by Diwali we have 80% of our population, adult population, who are immune. So that's going to give a good, healthy environment around in these festivities.
All right, because that remains the worry, isn't it, Doctor, going into this, festival season and all that talk of a possible third wave, though now I think most experts are agreed it's not going to be anything like what we saw this in the second wave. However, we have to continue to be very, very careful, and even if it's one jab, it doesn't provide that full sort of protection, and you have to continue following all the COVID protocols.
Yes, absolutely. So one jab doesn't mean that the person who got the jab has to becomes a casual enough that now he got the inoculation, so he can just roam about without any precautions. That's not the message. Message is very clear that jab gives you a extra step to be protected from COVID infection. But if that person is not following the COVID appropriate behavior, still he is vulnerable. So the vulnerability decreases, but it's not gone. So 2 jabs definitely gives a better protection. So one, the pace of immunization, I think if we can further improve or further make it faster or more stronger, that's going to be the message from the government side. That's what should be done. And second, anybody who got only 1 jab, please keep following all the COVID appropriate behavior very stringently in these festival season, because don't be taken by this message for granted that 1 jab gone and you are all free to roam about without any appropriate behavior. That's not the message. So message is, we are trying our best, government is trying our best by giving you jabs, but you also follow the regime of following this behavior stringently in this festival season.
Right. And Doctor, if we take a look at the global numbers, and that's something we just talked about, how the weekly number of COVID deaths worldwide has fallen to unseen levels for almost a year. So do you think this means we're turning a corner with this pandemic, and the fact that deaths are coming down and it's become the lowest than ever seen in a year? And also this points to the success of vaccinations, isn't it?
I think yes. So this is one of the best times in last 2 years where we are having the least infections and the COVID deaths going down remarkably. The reason I would give it to two basic reasons. One, because the COVID second wave was very intense, so it actually infected many guys, and in the society almost say symptomatic or asymptomatic 60-70% of the society of adult population was infected at some point of time. So that is one reason that some herd immunity was setting in. And second, the pace of vaccination. So if we say that 70-75% of persons, adult population is vaccinated, and more so, if the person who got a COVID infection and now gets vaccinated with a single jab, so it's almost like 2 vaccinations. So they are fully immune. But yes, if the person who's not exposed to COVID, they definitely requires 2 jabs. So both these things, the intense second wave and the carpeting of these vaccination all across our society, all across our nation. So these are the 2 main reasons why we are in better control of COVID infection in the society, and especially the mortality also.
All right, we're also joined by Dr. Rakesh Verma, Principal Consultant, DGHS. Thank you so much, Doctor, for joining us. And your reaction to the news yesterday, the Health Minister said that 70% of the population has received at least 1 dose of the vaccine. However, we still remain quite behind if we're going to give 60% of the population both doses of the vaccine by December, as the government has wanted.
Gargi, you must realize 2 things. India is a very diverse, very widespread country. with that very huge number of population of over 130 crores. In such a situation, Government of India, from the highest level, Honorable Prime Minister, Honorable Health Minister, Honorable Health Secretary, are devoting all their time to ensure that our population gets vaccinated in time, get vaccinated adequately, safely, and not a single patient who could be prevented should not be left over. Insofar as the other query that you raised, that at least 70% of adult population has already been vaccinated, that is a very, very good milestone. At least some exposure, at least part exposure to the virus has been done to 70% of outgoing population. Certainly, it will require a booster dose because, as you know, through the media, I must tell you, I want to tell the general population also, there are two kinds of immunity cells that body has got. One is beta cells, which have got short-term memory, which can last for weeks or months. But when you do a booster dose, the body produces T cell memory. I repeat, T for Tata type memory, which is long-term effective. And this is not only for this COVID vaccination. Remember your old days, remember the earlier years, when small children go for the polio vaccination, how many doses we recommend? 3 or 5 doses, not 1 dose, 3 or 5 doses, depending upon different regimens. First dose for exposure, second for short-term memory, medium-term memory, intermediate memory, and third booster dose for lifelong memory. And thereafter, we keep on recommending that every 5 years you can give a booster. So, far as the DPT is concerned, so for the other vaccination, MMR is concerned, we don't go for only single dose. Even for adults, when we give them pneumonia vaccine, that also requires a booster dose. So COVID vaccination also requires a booster dose. Now there are several vaccines available in the world, and at least 3 vaccines are available in this country, and more are in the pipeline. So I must ensure all of them will require, to some extent less, some extent more, a booster dose. But this milestone, which has been very nicely predicted said by the Honorable Health Minister, is that 70% of the adult population has been vaccinated, is a milestone not for India but for the world. Never ever, with such a rapid speed, with such a good efficiency, good administration, and remember one thing, its total cost is being borne by the Government of India. So government is supplied to 70% of its population first exposure to the vaccine, and I'm very sure, as you are aware, government will give the second dose also.
Right. Thank you so much for that. And of course, I think around the world, the governments are providing vaccines to the public to ensure that the public health is maintained and the public is protected. Yes. We'll slip into a short break now, and do stay on, Dr. Kapoor and Dr. Verma, because after the break, we're going to talk about Russia, where suddenly they're seeing an increase in the number of cases and, worries on that front. We'll take a short break. Be back with more. Welcome back. COVID news now from Russia, and the Prime Minister Mikhail Mishustin on Monday said the government had serious concerns about a surge in new coronavirus cases. On Sunday, Russia had reported 890 deaths from COVID, a record daily toll which had surpassed the 887 on Friday. The number of new infections announced was the second highest in the year at 25,769, and the surging number of cases has placed additional pressure in hospitals. In fact, in St. Petersburg, an exhibition center has been converted into a temporary hospital. Well, let's go back to Dr. Rajneesh Kapoor just to get your comments on this, doctor, because that's the worry, isn't it? What we saw in the United States and now in Russia, again, the COVID numbers are going up, which is why, as many of you doctors, continue to insist you have to continue being very, very cautious about the COVID. Even if the numbers are down, it could, go up again at some point. So we have to continue following all the protocols.
Yes, absolutely. So I absolutely concur with these thoughts that, coronavirus is not going away from our society, from our vicinity. It's going to stay. So even if the numbers go down, we can't be just becoming casual about it. So I think Russia, what happened, they opened the tourisms like anything. They were giving packages for all the outside nations or outside inhabitants from Africa or Asia to to come to their country as a tourism part. And second, their their vaccination program also went down and became, less paced. The pace of their vaccination program got stalled somewhere. So I think these are two main issues. And thirdly, the Delta virus exposure. So the countries who got exposed to Delta virus later on, like India got exposed to Delta virus in second wave extensively, I would say. But the countries who were not exposed, they were feeling the heat later. So Russia, these three reasons are the major reasons why now numbers are going up again. Very clearly to mention here that we can't take it for granted even if the numbers are going down. It has to be very stringent measures applied to the whole society by society itself or by the government, reinforced by the government. So they have to be in place. We can't just figure out that any casual attitude or COVID inappropriate attitude, it's not going to work.
All right. Thank you so much, Dr. Rajesh Kapoor, for joining us on the program.